Superantigens are powerful immune system activators produced by bacteria, notably Staphylococcus aureus. Unlike typical antigens, which activate a specific subset of T cells, superantigens bypass normal immune recognition, leading to widespread T cell activation and excessive cytokine release. This response is particularly relevant in allergic rhinosinusitis, where superantigens can worsen the inflammation and drive chronic disease. Superantigens bind directly to major histocompatibility complex, MHC, class II molecules on antigen-presenting cells and link them with T cell receptors without the usual antigen specificity. This leads to the activation of up to 20% of the body's T cells at once, compared to less than 0.01% in a typical antigen response. This massive activation results in a cytokine storm, contributing to severe inflammation. In allergic rhinosinusitis, particularly the chronic variant, superantigens play a pivotal role. Nasal colonization with superantigen-producing bacteria like Staphylococcus aureus exacerbates the allergic response. Superantigens amplify local inflammation, driving persistent symptoms such as nasal obstruction, mucosal edema, and chronic sinus pain. Superantigens disrupt the balance between Th1 and Th2 cells, skewing the immune response towards a Th2 dominant profile, which is characteristic of allergic diseases. This imbalance contributes to increased IgA production and eosinophil infiltration, hallmark features of allergic rhinosinusitis. Superantigens are strongly linked to nasal polyposis in allergic rhinosinusitis. The intense immune activation they cause leads to tissue remodeling and polyp formation, complicating the clinical picture and often necessitating surgical intervention. Identifying the role of superantigens in allergic rhinosinusitis involves assessing nasal swabs for Staphylococcus aureus and correlating with clinical symptoms. Understanding the superantigen load can help tailor treatment. Management includes antibiotics to reduce bacterial colonization, corticosteroids to control inflammation, and immunomodulatory therapies aimed at rebalancing the immune response. Emerging treatments like biologics targeting specific cytokines involved in the superantigen-induced response are also under study. For patients with recurrent allergic rhinosinusitis linked to superantigens, maintaining nasal hygiene and addressing bacterial colonization are key strategies. Regular monitoring and early intervention can help prevent chronicity. Superantigens significantly contribute to the chronicity and severity of allergic rhinosinusitis. By understanding their role, clinicians can better target treatment strategies, improving patient outcomes in this challenging condition.